Doctors are trained early in their education and throughout their careers to be skeptical of patient self-reports about diet and lifestyle. Not dismissive, skeptical is the correct word. We are trained in evidence hierarchies, in mechanism, in peer-reviewed literature. When a patient tells you in a follow-up appointment that they feel better since they started eating a certain food, the disciplined clinical response is to note it and not to draw a conclusion from it. Anecdote is not data. This is something we say constantly, in training and in practice, and there is good scientific reason for it. But over 35 years in vascular surgery, some patients kept telling me the same things. Independent patients at different points in their care, describing similar changes after similar dietary choices. And eventually, somewhere in the later years of my career, I began to listen differently. My name is Dr. Robert Hargrove. I retired after 35 years as a vascular surgeon, a specialist in blood vessels, veins, and the circulation disorders that accumulate quietly and progressively across the decades of a human life. One of the most consistent complaints I encountered throughout my career, particularly in patients over 60, was leg swelling, edema, the fluid that builds in the lower legs and ankles through the day, that leaves sock marks, that makes shoes feel tight by afternoon, that sends people to the end of the couch to elevate their feet in the evening. It is one of the most common complaints in this age group. It is also, in my observation, one of the conditions most undertreated at the lifestyle level. Today I want to tell you about 3 fruits. Fruits that patients mentioned to me over the years, independently, unsolicited, without any awareness of each other. Fruits I initially noted and moved past, and that I eventually investigated properly, looking into the mechanisms, reading the research, and coming to believe that what those patients were noticing was real, specific, and supported by more science than I had initially given credit for. Let me start with Dorothy. Dorothy was 74 years old and had been my patient for several years. I had performed a bypass procedure on her, and she was meticulous about her follow-up care. The kind of patient who arrives 5 minutes early, brings a list of written questions, and does not leave until she has answers she understands. At one of her post-procedure follow-up visits, she mentioned, almost as an afterthought, the way patients often mention things they expect to be dismissed, that her ankles had not been swelling the way they usually did. She said she had started eating fresh pineapple every morning, about 2 months prior, because her daughter had read something about it online. I told her I was glad she was feeling better. I wrote a brief note in her chart. I moved to the next item on the visit agenda. I did not look into it further. Approximately 8 months later, I was seeing a 69-year-old patient named Walter, a retired plumber recovering well from a venous ablation procedure, who mentioned in passing that the heaviness in his legs had improved over the past few months. He had started eating blueberries daily. His wife had read about it somewhere. He mentioned it with a particular kind of shrug, the shrug of a man of his generation acknowledging that his wife had, once again, been correct about something before he understood why. I wrote it down. I sat with it for a moment longer than I had with Dorothy's pineapple. 2 patients, different conditions, different fruits, similar unsolicited observations about reduced swelling in their legs, and I had noted both of them and moved on. I started looking into it after Walter's appointment, not because 2 cases constitute evidence, they don't, but because in medicine, a pattern of observation is the thing that sends you to the literature. And what I found in the literature was not a pile of anecdote arranged to look like science. What I found was a modest but consistent body of research, some of it clinical trial data, some of it mechanistic studies, on specific compounds and specific fruits, with documented physiological effects on the mechanisms that drive leg swelling. Let me walk you through each one. The first fruit is pineapple. The relevant compound is bromelain. Bromelain is a proteolytic enzyme, meaning it breaks down proteins, found primarily in the stem and juice of fresh pineapple. Proteolytic enzymes are more commonly associated with digestive health, and most people assume that any enzyme consumed orally is simply digested before it can exert systemic effects. This is not entirely accurate for bromelain. Research has shown that bromelain is absorbed from the gastrointestinal tract in biologically active form, meaning it reaches systemic circulation where it can act on tissues beyond the gut. In the context of leg swelling, the mechanism that matters is fibrinolytic activity. Fibrin is a clotting protein that, when present in excess in soft tissue, as it often is in chronic edema, forms a dense, protein-rich mesh around the lymphatic channels and small vessels in the lower leg. This fibrinous accumulation impairs the ability of the lymphatic system to drain interstitial fluid effectively. Over time, it contributes to a cycle of progressive swelling that becomes harder to manage because the drainage infrastructure itself is being compromised. Bromelain acts on this fibrin mesh. It breaks it down. In doing so, it supports more effective lymphatic drainage and reduces one of the structural contributors to chronic leg edema. This is not a theoretical mechanism. There is clinical research on bromelain for edema, including post-surgical edema, trauma-related edema, and the edema associated with chronic venous insufficiency. Beyond the fibrinolytic effect, bromelain also reduces prostaglandin synthesis, one of the primary inflammatory pathways that causes capillary walls to become more permeable and allow fluid to leak into surrounding tissue. Reduced capillary permeability means less fluid moving from the bloodstream into the tissue. Less fluid in the tissue means less swelling. If you want to incorporate pineapple for this effect, there are two things to know. First, the bromelain concentration is significantly higher in fresh pineapple than in canned or processed forms, because the high heat processing used in canning denatures the enzyme and destroys much of its activity. Fresh or fresh frozen pineapple is what you want. Second, the stem, the hard fibrous core in the center of a pineapple that most people cut out and discard, actually contains a higher concentration of bromelain than the surrounding flesh. If you can tolerate eating a small portion of the core, it is worth doing. If the texture is too unpleasant, the flesh alone is still meaningful. A cup of fresh pineapple daily is the dose range most consistent with the dietary research. The second fruit is watermelon. The relevant compound is citrulline. L-citrulline is an amino acid found in unusually high concentrations in watermelon, particularly in the rind, though the flesh contains it as well. When you consume citrulline, it is converted in the kidneys to L-arginine. Arginine, in turn, is the direct substrate for nitric oxide synthase, the enzyme your endothelial cells use to produce nitric oxide. We have discussed nitric oxide in other contexts. It is the primary vasodilating signal in the arterial system, responsible for relaxing smooth muscle in artery walls. But in the specific context of leg swelling, the relevant function is different. Leg swelling driven by venous insufficiency, which is the most common vascular cause of chronic leg edema in older adults, is fundamentally a problem of venous return. Blood needs to travel from the legs back toward the heart against gravity. This happens through a combination of mechanisms: the calf muscle pump, which squeezes blood upward through the veins when you walk, the valves inside the veins, which prevent backflow, and the tone of the vein walls themselves, which influences how efficiently the vessel contracts and moves blood. When venous wall tone is poor, when the vein walls are lax and compliant to an excessive degree, blood pools in the lower leg veins. Pooled blood creates elevated hydrostatic pressure within the vessel. Elevated hydrostatic pressure pushes fluid out of the vein wall and into the surrounding tissue. That fluid is edema. This is the primary hemodynamic mechanism behind the swollen ankles that build across the day and improve overnight when the legs are elevated and hydrostatic pressure is relieved. Nitric oxide supports venous wall tone. It does not cause veins to constrict. Veins don't work quite the same way as arteries. But it supports the integrity and responsiveness of the endothelial lining, which influences how permeable the vein wall is and how efficiently the vessel responds to the signals that regulate blood flow. Citrulline, by elevating arginine availability and supporting nitric oxide synthesis, contributes to better venous endothelial function. It is a different mechanism from the arterial dilation we discuss in the context of blood pressure, but the upstream pathway is related. Watermelon is the most bioavailable dietary source of citrulline available. 2 cups of fresh watermelon flesh provide approximately 1.5 to 2 grams of citrulline, which produces measurable increases in plasma arginine. The rind contains significantly more citrulline per gram. Some people juice the rind for this reason. I understand that this is an acquired enthusiasm. The flesh alone is sufficient. If you prefer to drink your watermelon rather than eat it, fresh watermelon juice is fully equivalent. Avoid commercial watermelon juice products with added sugar. The glycemic burden partially counteracts the vascular benefits. The third fruit is blueberries. The mechanism here is distinct from both of the above and addresses a third specific driver of edema. Edema is not solely a function of venous pressure and lymphatic drainage. It is also a function of capillary permeability, how readily fluid moves through the walls of the smallest blood vessels. The capillaries are where the exchange between blood and tissue happens. Oxygen and nutrients out, carbon dioxide and waste in. Their walls are extraordinarily thin, a single cell in thickness, and they maintain a selective barrier that, under healthy conditions, keeps most of the fluid volume inside the vessel. When that barrier is compromised, by inflammation, by oxidative stress, by structural degradation of the proteins that hold the junctions between capillary cells closed, fluid leaks into the surrounding tissue in excess of what the lymphatic system can efficiently drain. That excess accumulation is edema. The vascular permeability mechanism becomes more prominent with age, with diabetes, with chronic venous insufficiency, and with conditions that promote systemic inflammation. And it is the mechanism that blueberry anthocyanins appear most directly to address. Anthocyanins are the flavonoid compounds responsible for the blue-purple pigmentation of blueberries, and they have several documented effects on capillary function. They inhibit hyaluronidase and collagenase, enzymes that break down the structural proteins in capillary walls, including collagen. Less degradation of capillary wall structure means more intact barrier function, meaning less fluid permeability. They also reduce the expression of inflammatory cytokines that cause the tight junctions between capillary endothelial cells to loosen. Those junctions are what makes the barrier selective, and when they are disrupted by inflammation, permeability increases significantly. There is a body of clinical research on bilberry, Vaccinium myrtillus, the European cousin of the North American blueberry, specifically for chronic venous insufficiency, showing reductions in leg heaviness, edema, and discomfort ratings in patients with documented venous disease. Bilberry has a higher anthocyanin concentration per gram than cultivated blueberries, which is why the European research focused on it. Wild blueberries, available in the United States, particularly in the Northeast and from frozen suppliers nationally, have an anthocyanin profile closer to bilberry than to cultivated blueberries. If you can find wild blueberries, fresh or frozen, they are the stronger choice. Cultivated blueberries are still beneficial. The dose is simply slightly higher for equivalent effect. 1 cup of blueberries daily, fresh, frozen, or wild frozen, is the range consistent with most dietary research. Frozen berries are entirely appropriate. Anthocyanins are stable through freezing and thawing in a way that many heat-sensitive compounds are not. Now I want to be precise about something because precision here matters. Leg swelling has many causes, and not all of them are addressed by what I have described today. Edema caused by heart failure, congestive heart failure specifically, requires active medical management and is not a condition to treat primarily with dietary choices. Edema caused by kidney disease or liver disease requires evaluation of those underlying conditions. Edema caused by certain medications, calcium channel blockers, which are commonly prescribed for blood pressure and heart rhythm, are among the most frequent pharmaceutical causes of lower leg edema, may require a conversation with your prescribing physician about the medication rather than a dietary response. If your leg swelling is new and significant, if it came on suddenly, if it is accompanied by shortness of breath, by chest discomfort or pressure, by a sudden reduction in urination, or by swelling in one leg that is dramatically greater than the other, these are presentations that warrant medical evaluation before dietary intervention. The asymmetric single-leg swelling in particular should prompt evaluation for deep vein thrombosis, which is a different and more urgent clinical situation than the bilateral dependent edema I have been describing. I am speaking to the large population of adults over 60 who experience the familiar bilateral leg swelling, both ankles, building through the day, correlating with time upright, improving overnight, attributed by their doctors to chronic venous insufficiency or generalized dependent edema without detailed guidance beyond compression socks and salt reduction. For that population, and it is a large one, these three fruits offer complementary, mechanistically distinct, and well-supported contributions to the overall picture. Pineapple, through bromelain, addresses fibrin accumulation around lymphatics, and reduces capillary permeability via prostaglandin inhibition. Watermelon, through citrulline and the nitric oxide pathway, supports venous endothelial function and venous return. Blueberries, through anthocyanins, strengthen capillary wall integrity and reduce inflammatory permeability. These are three different mechanisms addressing three different contributors to the same clinical problem. You do not have to choose one. A daily routine that includes fresh pineapple at breakfast, watermelon as a midday snack or with lunch, and a cup of blueberries at some point in the day covers all three pathways. It is also, I would note, a genuinely pleasant dietary routine that requires no sacrifice of palatability. I think about Dorothy more than she probably imagines. She came to a follow-up appointment with an observation she expected me to dismiss, said it anyway, and turned out to be correct about something I had not investigated. That is a particular kind of intellectual courage, the kind that persists in the face of an authority figure who is moving quickly and not fully listening. I was not fully listening. I am listening now. In 35 years of surgery, I have seen what poor circulation really does. Let me show you how to address it before it reaches a surgeon's table. The warning signs were there. Nobody told them what to look for. And sometimes it turns out the patients themselves were finding pieces of the answer before I thought to look. If someone you know is dealing with chronic leg swelling, please share this with them. And the next time your doctor is moving quickly and you have something to say it anyway. Dorothy was right to say it. You might be too.